last couple videos I've done on alcoholism and mental illness, the abnormal mind and body of an alcoholic, have been very well received. And so I thought I would do one. Somebody asked me to talk more about dual diagnosis. A lot of people don't know what co-occurring issues or dual diagnosis is. And what that means is, as you know, if you've listened to my last vlogs, alcoholism is a mental illness. It's an abnormal state of mind and body. And a lot of people, when they quit drinking and using, excuse me, I just burned. I didn't even say excuse me. I was hoping you didn't hear me. A lot of people, when they sober up, realize they have other issues. I'll use myself for example. I also suffer from OCD. Not very severe, very, very minor. And someone in my family suffers severely from it. I didn't think I did, but once I sobered up, it gets a little worse. It switches around. That's what alcoholism does. It switches around on you. That's why people that quit drinking, I'll use this is a perfect example. There was a girl I helped who was a heroin addict, and she was very young. She was 17, and she got off heroin, and it was amazing, right? Her life changed, and everything was great, and I tried to explain to her what alcoholism was. I tried to explain to her the abnormal mind and body, and it didn't matter how you treated it. You're an addict. You have alcoholism, the disease. And she said, no, I don't, because I don't drink alcohol. And I said, no. This will switch around on you. Switch addictions. This will switch. So sure enough, she was off heroin for several years, and she decided she could drink because she was off heroin. Alcohol was never her problem. It was not her problem. And she started drinking, and I'll tell you, it took her down. It took her down, and it took years before she could get, cleaned up again. So that's switching addictions. The same thing with mental illness. Mental illness will flip around on you, and I see very well that my OCD has come up. I think first thing, it makes me more compassionate for people with mental illness. I do have mental illness in my family. And the person who has severe OCD saw what drugs and alcohol did in their life, so they don't touch it. They don't drink, they don't take drugs, they don't even medicate themselves for their OCD, unfortunately. I wish they did, but it's their choice. So they know that they're very smart. So they know that if they start drinking and using, it would start treating their OCD, and then they'd be off and running. So the same with me. Without the alcohol, see, when I was drinking and using, of course I didn't have OCD. I didn't have nothing. I was fine, no fear, no nothing, right? Just a ton of shit consequences. So I put that down, and now my mind is trying to make up other things to get me uncomfortable enough that I'm going to drink and use. And a lot of the people that you see on the streets are mentally ill people, and people think, oh, they're drug addicts, they're alcoholics, right? The guy's going to take my dollar that I'm giving him and buy booze. What he is trying to do is treat his mental illness. These people are on the street with no care for their mental illness, and they have to drink and use to self-medicate. And that is the government's fault. That's our fault. There used to be programs that provided people with medicines that kept them so they could hold jobs. Maybe not big-time jobs on Wall Street, but they were working at the grocery store or at the neighborhood shop, and they were paying for an apartment, and they were living an okay life. They were going to get their meds at a local place, like a methadone clinic, but they'd go get meds for schizophrenia or bipolar, whatever it was they were suffering from, and they could maintain, right? Not big money people, but they could maintain. When Ronald Reagan, Governor Schwarzenegger came to California, he got rid of all those places. That, my friends, is when you saw the homelessness jump in California. And everywhere else they did the same thing. That's when people hit the streets. They couldn't maintain. They had to start drinking and using. They lost their jobs. They're on the street. Not all of them are drug addicts and alcoholics per se. They are now probably have drug and alcohol problems. And so how do you help someone like that? How do you help someone? First thing you've got to do is you got to get them off the drugs and alcohol. But you got to be able to treat the mental illness underneath. Do you see that? Do you see how many people have other issues that have to be treated? So old school AA used to say, oh, you have to be off all drugs and alcohol. No, get off drugs and alcohol, mind-altering substances, and take the meds you're supposed to take to treat your other mental illness. If you are dual diagnosed, you have two things. But unless you are completely sober, you cannot take care of your other mental illness. Does that make sense? You have got to be sober so you can take your medication for schizophrenia. People with schizophrenia or any other mental illness, OCD, any other mental illness, you name it, manic depressive, anything. The common denominator with that and other mental illnesses is that people take their medicine. As soon as they take their medicine, they think they're better and they stop, right? The same with alcoholics and addicts. Alcoholics and addicts will go to AA, they will treat their alcoholism, they will do the steps, and they will help others, and they will pray and ask God for help, right? And then all of a sudden what happens? I'm better. I don't need to take my medicine. I'm good. And they back up. They back right out of the rooms of Alcoholics Anonymous or an NA or a GA or whatever, 12-step program. I'm sorry, I'm mentioning exact names, but you know what 12-step programs are. We're not idiots here. So they quit their program of recovery because they got it. And what happens? They drink and use again. The same with any other mental illness. Dual diagnoses are people that have other issues. If you take an alcoholic addict with schizophrenia, manic depressive, any other co-occurring problem, you take away the drugs and alcohol and you do not treat the underlying issue, they can't take it. They can't take it. They have to be treated. And if they don't get their medicine, they're going to treat it with drugs and alcohol. Mental illness, it's just like an alcoholic who is not treating their alcoholism. It's like a dry drunk. Have you ever seen somebody in a dry drunk? Somebody not drinking and using that doesn't have an answer? You want them, you go, oh my God, give this guy a drink, right? He's ready to go crazy. Postal. That's why people go postal. It's not a big shocker. Just people don't know. So if you have another diagnosis, if you think you have you need to go to a treatment center or a place that is going to understand that. And they are going to support that. They're going to help you detox from the drugs and alcohol so that you can get on the meds you need to take for your other issue. And it's a balancing act. It really is. And you need help with that. And if you don't stay sober, you will stop taking your other meds, and then it's all bad. It's a vicious cycle. Okay? So there are a lot of places that are very good, and I will be happy to refer you out. But that is what dual diagnosis means. That's what co-occurring means. And it will switch around on you. So you need to be, but you have to be sober so that you can look after this, whatever you've got going on. Okay? If you have questions, direct message me. I'd be happy to answer them. Thanks.